Typically, when patients get cataract surgery, the cataract, which is the cloudy lens, it gets removed, and in its place, they have a lens implant. So an IOL is an intraocular lens implant. Most patients, when they get cataract surgery, they do fine, and the lens implant stays in place. But there are certain disease states like ocular diseases or systemic diseases that can cause a lens implant to dislocate. Most commonly, you're gonna see it from either trauma, and this could be also from surgical complications. Pseudoexfoliation syndrome is also one of the more common causes of this. Usually a lens implant sits in a support system, what we call the capsular bag, and which is tethered in place by zonules. So a patient that has pseudoexfoliation syndrome, the zonules are weak, and that causes the lens to dislocate. Typically, patients are gonna notice blurry vision. Sometimes if the lens is just slightly off-center, they'll see the edge of the lens. Rarely patients will present with any type of pain. Usually when this happens, you should go ahead and see an ophthalmologist right away. But in terms of surgery, for the most part, you can wait anywhere between a week to a few weeks before surgery. And if the patient has any type of other ocular pathology, such as if they have a retinal tear or detachment along with it, then you would want to get that fixed as soon as possible. If you don't have that lens in place, that will affect your vision, so you won't see at your best potential. If the lens is dislocated into the back of the eye, such as the vitreous cavity, the vitreous being the gel in the back of the eye, that can make the patient more prone to tears or detachment. The only treatment for this is treating it surgically. There's many techniques that surgeons use to put the lens back in place. Most surgeons would probably remove the lens, and then they would put a lens implant in its place. Usually it's fixated to the sclera, with or without stitches or sutures, and it can also be placed in the anterior chamber, the front part of the eye. And if there's enough support in the eye, sometimes you can use that same lens implant and put it on top of that support.